All right, welcome back. Alzheimer's disease is a type of irreversible progressive brain disease that attacks and destroys the brain cells, which results in a loss of memory and other essential cognitive functions. Dr. Quinn joins us today with a look at the warning signs. Dr. Quinn, thanks so much for joining us today. Now, you mentioned that you had a family member that was affected in the fact that there was a level of denial resulting in a worse outcome. Can you explain that?
I certainly can. It was very difficult for our family. We had a family member, and we, including my family, like a lot of my patients and their families, we tend to want to be more comfortable. And it's very uncomfortable when you have a family member that are showing signs and symptoms of early Alzheimer's disease. And some of these signs and symptoms, which my aunt was exhibiting, included agitation. She was agitated very easily. Some depression. She was sad a lot, where she didn't want to come out of her room. But also, she was having episodes where she didn't remember things, like where she put her keys, or, it was progressively getting worse, to the point where she would sometimes go places and she didn't remember how to get home. But the family, we just didn't want to get the help, even though I pleaded. Being a medical resident at the time, I was pleading for us to get her evaluated. But it all came to an end when the ambulance and the fire truck came to her home after she cooked and then went to sleep and set the house on fire, burning the kitchen. But luckily, her life was saved.
Well, so glad that at least her life was saved. But Dr. Quinn, talk to us about the treatments now available and how can people gain access to those treatments?
Right. There are treatments now, and right now there's a lot of research with some new treatments that include technology similar to treatment for coronavirus, with the monoclonal antibodies that attack plaques, these amyloid plaques in the brain, which are part of the pathology of Alzheimer's. Is very exciting. It's very encouraging. But the take home is, in order for someone to get that treatment, they have to not ignore warning signs and get help for their family members if they start exhibiting those symptoms.
And with that, Dr. Quinn, what is the most important message that you want our viewing audience here at WJTV to remember about this life-changing condition?
Right. What we want the audience to know is, don't ignore the warning signs. If you have a family member or yourself, you might start having symptoms of agitation, depression, confusion, not remembering things as well as you used to. It's not anything to be ashamed of to go get evaluated. Now, UMC has a wonderful program called the Mind Center. That's a very comprehensive program that provides an excellent evaluation. But the only way these programs can help you is if you allow them. The best way to start it is talk to your primary care physician, your family doctor, your OBGYN, and whoever takes care of the patient, and let them evaluate them, and they'll be able to make the proper assessment and know when it's time to refer. But the take home is, help is out there, but we have to be receptive to it.
All right. Thanks so much always, Dr. Quinn. That was Dr. Quinn on our Focus on Health on WJTV. We'll be right back. Stay with us.